We are going to start with the COVID-19 situation in South Korea. The country is expected to report around 3,000 new COVID-19 cases on this Monday, as it continues to see a downtrend in the number of new infections.
Meanwhile, the current vaccine pass measures will be expanded to more venues beginning today. For more on this and other updates, we're joined by our Choi Min-jung here in the studio. Good morning, Min-jung.
Good morning.
So, like always, let's start with the local infections. What are we expecting today?
Mok-yeon, today we're expecting the daily tally to surpass the 3,000 mark. From midnight to 9 p.m. on Sunday, South Korea reported a little over 2,800 cases. This is down by around 170 cases from a week ago and more than 960 cases less than the week before that. The country has been seeing a decline in the number of cases since late December amid the country's booster shot drive. The average daily tally for the first week of 2022 was around 3,500. This is a drop of more than 1,000 cases compared to the week ending 2021, which saw an average of 4,600 cases a day. But authorities are still on high alert over increasing imported cases. On Sunday, the country saw 236 imported cases, the second highest ever reported since the onset of the pandemic. The latest data showed that 7 out of 10 COVID-19 carriers from overseas had the Omicron variant.
Now, vaccine pass, this system that has been introduced by the South Korean government has been expanded from today. How is it different now to what it once was?
Right. Vaccine passes will now be required for people to go to department stores as well as large supermarkets. The government has expanded vaccine pass mandates from venues like indoor sports facilities, nightlife entertainment venues, to public venues like restaurants, cafes, as well as places of learning. And pass requirements at department stores and large supermarkets is one of the latest moves to curb the spread of the virus. Now, to go to these facilities, people will be required to be fully vaccinated or test negative for COVID-19 within the past 48 hours. But there are exceptions for those aged under 18, as they are exempt from the mandate. And those who are employees of department stores or large supermarkets can work regardless of vaccination status. And people will also not need vaccine passes when shopping at small supermarkets and convenience stores. To give the new policy time to settle into place, there will be a grace period until the 16th.
So speaking of the grace period for the new vaccine pass policy has ended also. And so those who have expired vaccine passes will be restricted from entering facilities, right?
That's right, Mok-yeon. Starting today, vaccine passes for people who have been vaccinated, fully vaccinated, more than 6 months ago will no longer be valid. The government imposed a 6-month expiration date on vaccine passes on January 3rd. And like you just said, the 1-week grace period ended on Sunday. So starting today, those who received their final shot before July last year and haven't gotten booster shots yet will not be able to enter most facilities without a negative PCR test. Now, with this new policy, more than 340,000 people will not be able to use their passes. But with the extra shot, they will be able to extend the expiration date for another 6 months. Individuals who violate the pass mandates will be fined 100,000 won, which is around $83 US.
And there has reportedly been a new strain of COVID-19 detected in Cyprus, a combination of Delta and Omicron, they say. Tell us what we know thus far, and do we know whether this has come into South Korea yet?
Right, like you said, over the weekend, scientists in Cyprus reportedly identified a strain of COVID-19 that combines elements of both the Delta and Omicron variants, dubbed the DELTACRON. And according to local sources, DELTACRON cases were found in 25 samples. Analysis conducted by a biological sciences professor at the University of Cyprus showed that the new strain was more often found in patients who were hospitalized with COVID-19 than those who weren't hospitalized. The country's health minister said that the new variant is not a concern and said more details will come out this week. However, numerous scientists, including a WHO expert, says DELTACRON is unlikely to exist and was probably a result of contaminated tests. And on the local front, authorities in South Korea confirmed that no cases of DELTACRON have been confirmed in the country, but they vowed to keep a close watch on the situation.
All right, Min-jung, thank you so much for your report as always. We'll talk to you again tomorrow.
Thank you.